Good morning and welcome back, folks, to another edition of the SCSA's Toolbox Talk Tuesday. So my name is Riley Hancock. I'm a safety advisor here with the SCSA, and I've been with the association for just shy of 5 years. With today's time, we're going to run through a quick toolbox talk on the hazards of hantavirus and how to mitigate risk associated with the virus. So with the high population of critters in North America that can carry hantaviruses, there is a high likelihood you could come into contact with the virus. Today, we are going to talk about what hantaviruses really are, what the symptoms of hantavirus are, the transmission of the virus, how to prevent hantavirus, and wrap up with some other facts about the virus. Hantavirus pulmonary syndrome, or HPS, is a severe, sometimes fatal respiratory disease in humans caused by infection with hantaviruses. People get the virus from infected mice, rats, and other rodents, and different types of rodents can carry different types of hantaviruses. In North America, 5 rodents are known to carry hantaviruses. These include the deer mouse, the cotton rat, the rice rat, the white-footed mouse, and the red-backed vole. The deer mouse, the white-footed mouse, and red-backed voles are widespread in many parts of Canada. There are several different types of hantaviruses found around the world, and each can cause different diseases. The 2 most common diseases caused by a hantavirus infection are hantavirus pulmonary syndrome, which is most commonly found in North America and South America, and hemorrhagic fever with renal syndrome, which is mainly found in Europe and Asia. So symptoms of hantavirus pulmonary syndrome appear roughly 1 to 6 weeks after being exposed to the virus. And these symptoms can include tiredness, dizziness, fever and chills, muscle aches and headaches, nausea and vomiting, stomach pain, and coughing. More severe symptoms may include either a shortness of breath or a severe difficulty in breathing. We look at the symptoms of hemorrhagic fever with renal failure. Symptoms appear roughly 1 to 2 weeks after exposure, and these symptoms can include intense headaches, very similar to a migraine, back and stomach pain, fever, chills, nausea, and blurred vision. As the illness progresses, we could also have additional symptoms such as a flushed face, inflamed or red eyes, rash on the skin, and low blood pressure. Serious cases of hemorrhagic fever with renal failure may cause internal bleeding. So see a healthcare provider immediately if you've had contact with rodents or their droppings and urine, or are showing some or all of the above-mentioned symptoms after coming into contact with rodents or their droppings. Be sure to mention that you have had contact with rodents or their droppings or urine when speaking to your healthcare provider. Your healthcare provider will then look more closely for rodent-associated diseases and administer all applicable tests. People can become infected with a hantavirus when they inhale virus particles from rodent urine, droppings, or saliva that have been released into the air. Most commonly happens when rodent waste is stirred up from vacuuming or sweeping, so cleaning out the garage, garden shed, things like that. Either touching objects or food contaminated with the urine, droppings, or saliva of infected rodents, and in very, very rare cases are bitten by a rodent infected with a hantavirus. So with the exception of the Andes-specific hantavirus, the virus does not spread through person-to-person contact. So to prevent hantavirus, there is no vaccine for hantavirus infections. The key to disease prevention is preventing rodent infestations, properly cleaning and disinfecting areas contaminated by rodent droppings, keeping your home, workplace, cottage, or campsite rodent-free. All rodent droppings are potentially harmful, so you should block all openings that might let rodents in. Store all of your food, water, and garbage in containers with tightly fitting lids. Place mouse traps throughout your buildings, your garage, your sheds. Keep your yard clean and stack wood piles away from buildings. To properly clean and disinfect areas contaminated by rodent droppings, follow the steps below. Wear rubber or plastic gloves. If you are cleaning in confined space, wear a high efficiency particulate air filtered respirator or a HEPA filtered respirator. Do not sweep or vacuum rodent droppings. This will release more particles into the air, which you could then breathe in. Spray any droppings found with a household disinfectant or a mixture of 1 part bleach to 9 parts water. Let the area soak for 10 minutes to make sure any virus within the droppings will in fact be killed. Wipe up wet droppings with paper towels, or if you're dealing with a larger area, use a wet mop. After cleaning and disposing of the droppings, wash your gloves in disinfectant and hot soapy water before you remove the gloves from your hands. After removing the gloves, wash your hands thoroughly. If you used a wet mop working in a larger area, clean and disinfect the mop as you would your hands. Use disinfectant and hot soapy water to clean that mop. If you start experiencing any of the symptoms mentioned earlier after cleaning rodent droppings, see a healthcare provider immediately. So treatment of hantavirus. Infection with a hantavirus can be fatal, and there are currently no treatments available. Treatment is provided to improve a patient's symptoms, and that is pretty much it. Treatment options include supportive care, help to maintain oxygen levels, and help to prevent dehydration or loss of body fluids. About 40% of those diagnosed with hantavirus pulmonary syndrome will not recover from their illness. Depending on the virus, about 1% to 12% of those diagnosed with hemorrhagic fever with renal syndrome will not recover from their illness. Consult your healthcare provider as soon as possible if you had contact with rodents and are feeling ill. The sooner you get treatment, the better your chances are for recovery. So just some facts here to wrap up our toolbox talk. About 200 cases of hantavirus pulmonary syndrome occur each year, primarily in North and South America. The average case fatality rate is 40%. Since 1989, there have been 109 confirmed cases and 27 deaths in Canada due to a hantavirus infection. There have been 31 cases of hantavirus pulmonary syndrome reported in Saskatchewan since 1994. Out of the 31 cases, 10 of them have resulted in death. Currently, there are no vaccines available to prevent a hantavirus infection. And last little fact about hantavirus, the virus does not remain active for long once outside of the host. Less than 1 week outdoors, and only a few hours when exposed to direct sunlight. So thank you all for your time. The Saskatchewan Construction Safety Association, or the SCSA, is an industry-funded member-based nonprofit organization that provides cost-effective, accessible training and advice to employers and employees in the construction industry throughout Saskatchewan to reduce the human and financial losses associated with injuries. With our training services, you can gain valuable working knowledge of various health and safety management skills and principles that will allow you to administer and implement an organization's health and safety program through our Health and Safety Administrator, HSA, and National Construction Safety Officer, NCSO programs. Also, choose from over 50 online training courses that cover a wide variety of topics, professional development, and occupational health and safety topics. The SCSA Safety Advisors provide hands-on support to help you develop, implement, and continually improve your company's health and safety management system. If you have any questions about the information provided here today or any safety-related questions or concerns, please feel free to reach out to us, the Saskatchewan Construction Safety Association, and ask to speak to an advisor. So that concludes the Toolbox Talk for today. I want to thank you all again for helping us make Saskatchewan Canada's safest construction environment. Take care.